Good evening, everyone. Let's discuss with the UPSC CMS recall paper. I will be discussing cardiovascular system, GIT, and general medicine question. So this paper is a very high quality paper, and they ask clinical questions. And almost all the questions are from textbook of Harrison. So let's start with question number one. Question is, height of jugular venous pulse is determined by which chamber of the heart? So it is obvious question that right atrial pressures are reflected in the right internal jugular vein. So this is JVP, right internal jugular vein. So answer is A option here. Question number two. Question number two is, SA node is situated at the junction of SA node is situated in right atria. So either it is A option or D option. Now SA node is superiorly located. So it will be between the junction of superior vena cava and right atria. That will be the obvious answer. So answer is A option for this question. Question number three. Question 3 is, high cardiac output failure is caused by which of the following conditions? So high output cardiac failure is due to beriberi. Beriberi is vitamin B1 deficiency, and B1 deficiency causes the vasodilatation due to lack of inhibition of nitric oxide, and vasodilatation means cardiac output will increase. Severe anemia causes hypoxia, and hypoxia is the reason for systemic vasodilatation, and whenever vasodilatation process occur, cardiac output will be increased. Thyrotoxicosis because of increased beta 1 receptors, so this is also high cardiac output. So answer will be D option. All of three are high cardiac output conditions. Moving to question number 4. Question is, reverse splitting of the second heart sound is most commonly seen in which condition? Reverse splitting of the heart sound means ki suppose this was supposed to be A2 sound here, and this is P2 sound. So A2 is coming late, so it is coming later than the P2 sound. This is the meaning of a reverse splitting. Late A2 will occur either when the ejection time of left ventricle is increased or left ventricle depolarization is late. So depolarization late will be seen in left bundle branch block. So that causes a late A2 responsible for the reverse splitting, while ASD, severe MR. So in this condition, there is a wide split. While same for pulmonary hypertension, there is a wide split. Reason being late P2, so that will make the split wide. So answer is C option. And those students who have attended the cardiovascular class, they can correlate. It is the exact thing that we have discussed in our classes. Now coming to the next question. Next question is question number 5 in the list. So question 5 is, which of the following are the major criteria under the Jones criteria for rheumatic fever? So we have to choose the option from the wide and fixed split, sir. Wide and fixed split will be seen in ASD. That will be atrial septal defect. Now, in this question, Sydenham's chorea is a major criteria. Erythema marginatum is also major criteria, and subcutaneous nodule is also major criteria. Polyarthralgia is a major criteria in high prevalence zones. Major criteria in high prevalence zones, like in India. So we have to choose whatever option is given to us. So if the option is all four, that will be the best answer. If option is all four, but here the options are given as only three options, so you have to choose. So the best option will be 1, 2, and 3, because these are definitely the major criteria, whether it is a high prevalence zone or a low prevalence zone. So answer is A option here. Now come to question number 6. Question is 70-year-old man with dyspnea on exertion has found to be a single heart, second heart sound and a diamond shaped murmur. Diamond shaped murmur is this type of a murmur. That means ki it is a ejection systolic murmur. Ejection systolic murmur in a cardiac cycle. And this murmur is best heard at the right second intercostal space. And all of you know that right intercostal space is the aortic area. So this murmur is heard in the aortic area. Radiating to the right carotid, this is a typical clinical examination here. So answer is aortic stenosis. But why? Single heart sound is there. So the reason is patient age is 70 years. So calcified valve is there. So in a calcified valve, there will be absence of A2. A2 will be absent. If A2 is absent, so you will hear a single second heart sound. So this is the reason here. Number 7. Which of the following is the appropriate scoring system to assess the risk of stroke in a patient of non-valvular chronic atrial fibrillation on anticoagulation? So that scoring system which increase the risk is a Charts-Watts score. This should be more than equal to 2. So it is a high risk for the stroke. Charts-Watts score means ki C stand for CHF, 1 point will be given. H is hypertension, 1 point. Age more than 75, 2 points. Diabetes 1 point. Stroke history or TIA is 2 points. Vascular disease 1. Age more than 65 1 and female gender 1. So answer will be D option here. So more than equal to 2 is high stroke risk. All right, now coming to some questions on, so this was the question on the cardiovascular system. Now the question on the GIT. So question on the GIT is gold standard for the diagnosis of celiac disease is endoscopic biopsy, stool routine microscopy and culture. Remember, celiac disease is non-infectious. So routine microscopy and culture will not give you any information. Abdominal ultrasound is not good for assessing the loss of villi, which is typical hallmark of celiac disease. Antiparietal cell antibody have no role here. So answer will be A option, endoscopic biopsy, that is a gold standard. But if the question comes ki what is the screening investigation for diagnosis, then answer will be anti-TTG. That will be the answer, anti-TTG. So answer here is A option, endoscopic small bowel biopsy. Now moving on to the next one. So this is question number 8. Now come to question number 9. So question number 9 is a slightly tricky question. Question is with regard to H. pylori eradication in peptic ulcer disease, consider the following statement. So again, this is according to the option which is available to you. Proton pump inhibitor is taken with 2 antibiotics. Yes, if we are giving the 4 drug regime O, B, T, M. So omeprazole is proton pump inhibitor, bismuth, T is tetracycline, and M is metronidazole. So 2 antibiotics are given. This is a true statement. Now, treatment is prescribed for at least 7 days for H. pylori. Ideally, it is 14 days. Ideally, 14 days. Treatment of H. pylori infection leads to B12 deficiency. No. Treatment is given only for 10 to 14 days at the most, maximum 2 weeks. So that will not cause any B12 deficiency. So this is false statement. So third is totally false. Patient requiring long-term NSAID should undergo H. pylori eradication to reduce the ulcer risk. Yes, this is true. Those patients who are taking NSAID, they should check themselves for H. pylori. If positive, then undergo eradication. So combined effect of NSAIDs and H. pylori will be reduced. So this is a true statement. So the best answer for this option will be 1 and 4, but no 1 and 4 option is given. We have to then take 7 days also. Sometimes some physician give the medicines for 1 week only. So answer will be 1, 2 and 4. 1, 2 and 4 will be the best answer here. B option will be the best answer. But remember, the ideal duration of treatment is 14 days. So this is slightly a tricky question according to the options. Coming to question number 10th. Question is, which of the following are the precipitating factors for hepatic encephalopathy? Hypokalemia. So hypokalemia causes a decreased peristalsis, and decreased peristalsis means bacteria will increase, bacterial proliferation will be there. And if the bacteria increase, they will produce more and more of ammonia. So this is a precipitating cause. Septicemia is a sort of stress to the body. So this will lead to encephalopathy. Septicemia, surgery, any fever, all of these are stress induced, so they will lead to increased dietary protein. It has been seen that high dietary protein will cause more and more of ammonia. So answer here will be all the above. So answer is D option 1, 2 and 3. Also know that beside hypokalemia, low sodium do lead to precipitation of the encephalopathy. Yes. Question number 11. Liver related, GIT related question. Question is Crigler-Najjar type 1 is inherited as. So this is a stat question, one liner question. It is inherited as a autosomal recessive disorder. So fact based question. Question 12. Whipple disease is characterized by infiltration of small intestinal mucosa by foamy macrophages. Which of the following is the histological stain characteristically used? So the typically Whipple disease is diagnosed by PAS positive foamy macrophages. So the stain used here will be PAS positive. D will be the correct answer here. So Sudan black, remember Sudan black stain is for the fat malabsorption, Sudan stain which is used for fat. Now coming to the question number 13. Question is, poorly absorbed antibiotic are often used as adjunctive therapy in the patients with hepatic encephalopathy. So poorly absorbed means that these antibiotics, they will inhibit the proteolytic bacteria of the GIT, and these are the proteolytic bacteria which are responsible for production of ammonia. So ammonia production will be reduced. And why non-absorbable should be used? Because of their less toxicity, means they will not go into the blood to go to lead to some renal or hepatic toxicity. So answer is best out of all these will be the D option, neomycin or rifaximin. These days we use rifaximin as the drug, antibiotic of choice for hepatic encephalopathy. So D will be the answer here. Question number 14. Question number 14 is patient has a low ascites albumin gradient. So whenever it is less than 1.1, so what does the less than 1.1 means? That is serum albumin minus ascites albumin. So if this is less than 1.1, so it will be because of either serum albumin is low or ascites albumin is increased. These are the two reasons for the ratio or for the gradient to be less. Serum albumin is low in a nephrotic syndrome, and ascitic albumin is high in inflammatory conditions. Why? If it is more than 1.1, then it is highly suggestive of the portal hypertension related causes, that is any reason of high sinusoidal pressures. Whether it is cirrhosis, portal hypertension, cirrhosis induced portal hypertension, or it is CHF or cardiac ascites, or it can be because of Budd-Chiari syndrome. So the answer here will be infection is inflammation like tuberculosis can lead to a low gradient. Malignancy, true, because it is inflammatory. So the answer here will be 1 and 2 will be the correct answer here. And portal hypertension will not be the cause. Cardiac ascites will not be the cause. So 1 and 2, where is the option 1 and 2? Let me see. Yes, B is the correct answer. 1 and 2 will be the right answers here. Cardiac ascites and portal hypertension cause more than 1.1. So here answer is B option. Question number 15. Question number 15 is a sigmoid configuration beak-like deformity at the lower esophageal sphincter on barium swallow is a feature of like this. This is a beak-like deformity on the barium swallow. So this is highly characteristic of the ecclesia cardia. C option will be the correct option. While diffuse esophageal spasm causes this corkscrew type of the pattern in the barium studies. Corkscrew for diffuse esophageal spasms. So answer is C option. Now come to question number 16. 39-year-old female presents with severe autoimmune hemolytic anemia. Which of the following should be the initial step? Read the question carefully. Initial step. So for autoimmune hemolytic anemia, initial drug of choice is always steroids. So we will give steroids. And depending on the cause of that autoimmunity, then might we can add later on some other immunosuppressive agents. But initial therapy always start with steroids. Question number 17. Which of the one of the following is the most appropriate initial management for severe hypercalcemia? So always remember, severe hypercalcemia patients, they have a symptom of vomiting as well as they develop diabetes insipidus. This leads to dehydration. This is the main concern here, severe. So for dehydration, always give C option. That means the intravenous fluid of normal saline should be given. And once this appropriate hydration is maintained, then we can go for the furosemide, or we can opt for the bisphosphonate. But always and always start with the dehydration thing. And hemodialysis is for refractory cases, not the initial, but refractory cases. Read this one, initial treatment. So answer is C option. Question 18. Which of the following are used in calculating the serum osmolality? So serum osmolality is calculated as twice of sodium plus blood urea nitrogen plus glucose in millimoles per liter. If you take the millimoles per liter osmolarity, and if the parameter used are sodium, glucose, and blood urea nitrogen, 1, 2, and 4. 1, 2, and 4. Where is the option? B option. 1, 2, and 4 will be the options. Now coming to question number 19. Okay, so question number 19 is very easy from the other options. Which one of the following disorders are caused by enzymatic defect in the heme biosynthesis pathway? So heme biosynthesis pathways will develop porphyrias. Question 20. Which one of the following is an inhibitor of intestinal mucosal transporter Niamin-Pick 1L 1 receptor, which is responsible for the absorption of dietary and biliary cholesterol? So this is a receptor in the small intestine. So small intestinal receptor that is responsible for absorption of the diet and biliary cholesterol both. So answer is D option. This is given in combination with atorvastatin or other statins, and that will control the cholesterol values. So if you are struggling in controlling the cholesterol value, just add ezetimibe 10 milligrams. That will control high cholesterol levels. Number 21 comes the infectious diseases. So they have asked lots of questions from the infectious disease, so mostly microbiology. So slapped cheek appearance is correctly seen in parvovirus infection, and that is erythema infectiosum. So this is also the question which is asked in your NEET PG exams as well. Slapped cheek appearance. Now next question. Question 22. So question 22 is which of the following pharmacological agents can be used to treat the visceral leishmaniasis? So can we give pentavalent antimonials? Yes, sodium stibogluconate is given. So this is true. Amphotericin B, these days we use liposomal formulations. True, this is also true. Spiramycin and paromomycin, this is paromomycin which is given. This is a sort of aminoglycosides with activity against the visceral leishmaniasis. So answer will be 1, 2 and 4. Where is 1, 2, 4? 1, 2 and 4. B option. That will be the correct answer. Question number 23. Question is, which of the following immunizations are recommended for patient infected with HIV patients? So in every patient of the HIV, we should recommend hepatitis B vaccine. True, because HIV and hepatitis B have same mode of transmissions. Influenza virus yearly, it should be given. Pneumococcal vaccine, yes, true, it should be given. So all the vaccines are important for HIV patient. So answer will be D option. Question 24. Question 24 is a microbiology question. They have asked the technique. The Sabin-Feldman dye test is an indirect antibody test against which infection? So answer is this is fact-based. Toxoplasma will be the correct answer here. A is the correct answer. Question 25, again one-liner question. Cat scratch disease is caused by infection of which organism? Answer is D option. Bardotenera hanseli will be the correct answer here. So cat scratch disease. Question 26. Any contraindication of vaccination in HIV? Yes, good question. The contraindication will be especially for MMR vaccine. So MMR vaccine should be given only when CD4 count is normal. With a low CD4 count, immunity is low, do not give MMR vaccine. All right. So which among the is the first intermediate host for parasitic fluke? That is a Chinese liver fluke. Yes, it is snail. Freshwater snail or fish is the correct answer here. 27. 27 is Calabar swelling, which is short-lived inflammatory edematous swelling close to the limb joints, is characteristically seen in infection, which is caused by, answer is C option. Will be C option. 28. Characteristic. Snowflake deposits on the edge of cornea is seen in which condition? So the hint to you is it is also known as river blindness. So the larva, microfilarial larva deposit in the eye, deposit in the cornea. So answer for this question will be D option. Yes, D will be the correct answer here. River blindness. 29. Which among are the liver flukes? So out of all these, all are the liver flukes. So A option is Chinese liver fluke. This is the common liver fluke. And D option is a cat liver fluke. While Mononella, it mainly causes fever and skin rashes, illness with joint pains. So this does not cause. So answer will be 1, 3, 4. 1, 3, 4 where it is given. Yes, C option. 1, 3, 4 will be the correct option here. Now come to question number 30. Consider the following statement with regard to vitamin D deficiency. So vitamin D deficiency is a very common deficiency in clinical practice. So answer here will be vitamin D deficiency is common in the northern latitudes. Yes, because of less of sunlight. True. Vitamin D deficiency is more likely to develop in patient with dark skin. Yes, even in India where the sunlight can be direct, but due to the dark skin, the conversion by UV rays of cholesterol to vitamin D is reduced. Exposure to UV light is advisable in patients with vitamin D deficiency. Yes, there is no harm. Exposure to UV light is okay. So answer here will be 1, 2, and 3 all. All. 31. Which of the following is true about the acetaminophen? It does not interfere with the platelet function. Yes. So it is safe in low platelet disease like dengue fever. So it is the only antipyretic which is advised. So this is true. It is toxic to the liver in high doses. Yeah, definitely it causes toxicity. This is leading to the fulminant hepatitis, one of the common cause of fulminant hepatitis. It is a non-narcotic analgesic. Yes, it can be used as an analgesic agent. True. So answer is all. So is the all option given? Let me say. Okay. So all option is there. 1, 2, and 3. D is the answer here. Now coming to the next one. Which of the following are the causes of acquired systemic amyloidosis? So acquired systemic amyloidosis can be a primary amyloidosis, which is seen in multiple myeloma, true, or it could be a secondary amyloidosis, which can be seen in tuberculosis. If it is chronic, untreated rheumatoid arthritis, it is the most common cause of secondary amyloidosis indeed. Chronic osteomyelitis. Chronic osteomyelitis is true. This is a secondary amyloidosis. So answer will be all the above. D will be the correct answer here. Correct answer. Next one. So this was, let me write down the question number. Question number 32. 33. Consider the following statement regarding the paracetamol toxicity. So toxicity is caused by intermediate reactive metabolite that binds covalently to cellular proteins, causing the cell death. Yes, that causes the cell death because of the reactive metabolite. This is true. Now, antidote for paracetamol act by replenishing the hepatic glutathione and should be administered to all the patient with acute poisoning. No, this is not administered to all the patient. We check the acetaminophen levels at 4 hours. That is most crucial. So that decide the need for the N-acetyl cysteine. So this is first statement is true. Second statement all is false. Not needed in all the patients. Intravenous acetylcysteine is antidote if administered within 4 hours of overdose. No, it should be not 8 hours. It should be within 4 hours. So here the 8-hour thing will be 4 hours. Methionine can be used as an alternative antidote, but it is less effective than N-acetylcysteine. This is true. So the answer here will be 1 and 4 will be the correct answer here. So A is the correct answer. Now, next one, question 34. Which of the following are used in the management of hyperkalemia? 10% calcium gluconate intravenously, true. Regular insulin and intravenous glucose, yes, it reduces the potassium levels. Nebulized ipratropium, no. Nebulized, it will be salbutamol, not ipratropium. So this is false. Intravenous soda bicarb, yes, especially if there is a metabolic acidosis associated. So answer will be 1, 2, and 4. 1, 2, and 4 will be B choice. 35. Nebulized salbutamol is used in the management of which of the following electrolyte abnormalities? So we have just discussed nebulized is used for hyperkalemia. It causes the intracellular shifting of the potassium from blood into the cells. So answer is B option here. Question 36. Poisoning with which of the following drugs causes the hypothermia? So the reason for the hypothermia out of all the agent is vasodilatation causing. So heat dissipation occur. So patient will develop hypothermia. So this is alcohol, and other agents are opioids, overdose, and benzodiazepines can cause hypothermia. So answer is D option. Question number 37. Question is, consider the agent and the cardiac effect in the overdose or the poisoning. So the prolonged PR interval due to lithium. No, the lithium causes a prolongation of QT interval. Amidron QT interval, yes, this is true. Kerosene ingestion. Kerosene ingestion as such does not cause wide QRS complex. This is hydrocarbons. They cause tachycardia and they cause QT interval prolongation. Organophosphorus is acetylcholine activity is more. Acetylcholine activity will be more here. So tachycardia or this organophosphorus. So basically it is an inhibitor of acetylcholinesterase. As a result, acetylcholine level will increase. Acetylcholine level will increase. And when the acetylcholine level will increase, what will happen to the heart rate? So all of you can tell me कि heart rate will not be tachycardia, it will be bradycardia. So how many pairs correct? Only one pair is correct here. Second one, yes. All right, so these are the questions of GIT, cardiovascular system, and general medicine. If you have any doubt or any queries related to this, we can discuss in the comment section. So you can put your doubts in the comment section. So all the very best to you for your result or the exam you are going to give, NEET PG exam.